I grew up in a small town with both parents being physicians, and my mom was one of the first female physicians in Alberta, and I always knew that I wanted to be a physician. I think having a good supporting spouse is very helpful, and if you're having children, I think that having either other family help, extended family, or a nanny really makes your life much easier so that you can divide your time equally between your family, your social life, and a very busy career in medicine. Certainly when in obstetrics, when you lose babies, that's a very difficult time. And actually when I first I was a nurse first, and my first operation, I passed out and I decided this was not for me. But thanks to my mom, she figured I'd get over it and I was able to get through that. So I think loss of patience is very difficult to weather, and just knowing that you still enjoy helping people is the thing to help you keep moving forward. And colleague support is huge. I'm a generalist and I like being involved with my patients. So for me, birth to death. So I would be delivering babies that I delivered, and also dealing with the grandparents who palliative care. I was able to still look after them when they were sick in hospital because we didn't use hospitalists. And even in the emergency department, people would be coming in and I would know them and I'd know their history, I know their background. And so being able to do a little bit of everything is something that gave me a lot of pleasure. I didn't think I could do any one thing specifically for a long time, which is why I went into rural medicine instead of urban medicine. Well, for me, I live in the community. A lot of the people there are my friends. So you are a participant in the schools, in the hospital, in the whole social network, and that's where I gain my satisfaction. So for me, being part of a rural community was really important instead of being somebody who doesn't really know the people or being part of that community. So rural life was, for me, more so than urban. So I think the most important is work hard and enjoy the people you're with and have good support. The support is critical. My husband is very supportive. We'll be married 50 years next year. And I think that was part of our life. And we had a wonderful nanny. After we'd had 2 children, we got a nanny to help us, which meant that we could enjoy the children as well and have help in the home. And it made a big difference to us. So. A number of years ago, I decided to do GP anesthesia, and that really helped my career as far as feeling more confident. I did obstetrics, I did emergency medicine, and the doing residency in anesthesia as well helped build my confidence in those areas. And so I certainly am happy that I was able to give good care to a family practice and do all the things that I feel rural doctors should be doing, as well as being able to raise 4 wonderful children, and I now have 9 grandchildren, and they all seem to be healthy and doing well.